we will do norma basalis now, as you have asked. Like, see, this is the basal view of the skull bone. So it has been divided into anterior part, intermediate part,
Mm-hmm.
and the posterior part. Okay.
Mm-hmm.
So anterior part is nothing but this one. This is the posterior limit of the hard palate at lower level. This one. Okay. So intermediate part is a line which you draw in front of the foramen magnum. Okay,
Mm-hmm.
transverse line across anterior margin of foramen magnum, and in front, like between the anterior and intermediate lines, we have intermediate part. Behind this transverse line, we will have the posterior part. Now let us try to understand. If you have skull bone in your hand, it will be more better for you, but I simultaneously you will appreciate so many things. Hope you have that in your hand now.
I have the skull bone, but it's not as like the structures are not that good.
You don't have right now at your home.
I do, but the structures are kind of like decimated.
Okay. So try to appreciate better. If you're not, you just on the video, I will tell you. Okay.
Okay, no, see, I have we've seen it at school, so I kind of know what they look like.
Okay, you have an idea. Okay.
Yeah.
Okay then. See, this is in the anterior part. This area is completely hard palate. Two different colors have been used. Like this is the maxilla bone, which are actually palatine
Mm-hmm.
processes of maxilla. These are true palatine bones, which light green, olive green color has been used. So this
Mm-hmm.
completely forms the hard palate. This area is actually called as alveolar arch, where we have the sockets for the teeth. Okay. Then this area
Mm.
is actually called as incisive fossa. Okay. So actually this area is actually like you have a dental formula only in one half of the jaw, which you usually study in intermediate also. Two,
2132.
two, one, two, three beta. Okay. Two, one, two,
Ah,
three.
yes, yes.
Ah.
Mm-hmm.
Two is incisors. Okay. One is canines. Two,
Mm-hmm.
remaining two is premolars, and the last three are molars. Incisors, canines, premolars, and molars. Two, one, two, three. Okay, beta? Well,
Mm-hmm.
so now if you just observe, there are holes also here in this skull bone also, you try to appreciate. These are nothing but the greater palatine foramen, behind which small hole will be there. You call it as lesser palatine foramen. So this is completely hard palate because it is colored picture. I am just trying to make it understand. So these are nothing but the choanae are like the posterior nasal apertures or choanae, we call them as. Okay.
Uh-huh.
This bone is vomer bone, and this
Ah,
is,
yes, ala, vomer, and rostrum of
yeah,
sphenoid.
very
That
good.
was
Yeah, yeah. It forms the
it was a
partition,
fibrous
legal
joint,
system. Yeah, very good, very good. Okay, now this is
skin
pink in color.
desculum or something, right?
Yes, better.
It was something like skin syndesmosis, I think.
Syndesmosis. Yeah, you're right. Okay. Then you are finding pink in color, whatever bone is there, that is sphenoid bone. So you have like this area is actually greater wing of the sphenoid bone. Okay. Then you are finding we have like medial pterygoid plate, lateral pterygoid plate. This is medial near to midline. This is lateral pterygoid plate. Okay, then
Okay.
within this sphenoid bone, you have an oval foramen, which is called as foramen ovale, behind which, from interior view of the skull, you will see more clearly there is one more foramen called as foramen spinosum. Okay. Now, in orange color, whatever bone has been shown is temporal, and this temporal bone looks very much irregular, hence it is called as petrous part of the temporal bone. So in this petrous part of the temporal bone, you are finding a hole again foramen, that is the foramen lacerum. Okay.
Okay.
As you proceed, you are finding this is carotid canal or carotid foramen, behind which you are
Mm-hmm.
finding jugular foramen. Okay. So two
Okay.
projections are seen, one nipple-like projection which you can feel behind the ear. You call it as mastoid process. More
Yes.
medially, sharp spine-like projection is there. That is styloid process.
Tyloid.
Yeah, very good. Between mastoid process and styloid process, there is a hole that is called as
Yeah.
Tylomastoid foramen.
Okay.
Tylomastoid foramen. And outside, in norma lateralis also, you will see this opening. This is nothing but external acoustic meatus. Okay, this one. External,
Okay.
lateral view also we have
Acoustic
seen
meat.
this. External acoustic meatus. Okay, so this,
Okay.
now if you just observe in this temporal bone, there will be one fossa where head of the mandible comes and articulates to form temporomandibular joint. You call this fossa as mandibular fossa. Mandibular.
Okay.
Yeah. Now, if you just observe, like basically this violet in color bone is maxilla, adjacent to which
Maxilla.
you have blue bone.
Zygomatic.
Yeah, very good. Zygomatic. So zygomatic will have an arch. Half of the arch will be contributed by zygomatic bone. Half of the arch will be contributed by
Temporal.
temporal bone. So this would be temporal process of zygomatic from the
And that
zygomatic
would be
bone. Zygomatic
the
process of
zygomatic
temporal
process of
bone.
temporal
In
bone.
between, we will have suture, isn't it? So this
Mm-hmm.
is all zygomatic arch. Okay.
Mm-hmm.
Yeah. Now, see, this looks more clear because colors have been used. Now, coming to this area, you call this as basi occiput. This is all occipital bone, Bhavya. So you are finding there is one midline tubercle. You call it as pharyngeal tubercle. So these are occipital condyles. This,
Occipital condyles.
yeah, this is posterior condylar canal. This is foramen magnum. Okay, this is external occipital crest. This is external occipital protuberance. We have highest nuchal line, then we have superior nuchal line, then we have inferior nuchal line. In front of
Yes.
the occipital condyles, we have one more canal, same like this. It is hypoglossal canal. Okay. Now let me
Yeah,
see.
that's where the hypoglossal nerve, which is the 12th cranial
Hypoglossal
nerve,
nerve comes out.
will arrive.
Yeah, very good. I'll tell you all the structures which are passing. Now let us try to observe. Now when you hold the true skull bone, you should appreciate. See, this is foramen incisive. Incisive foramen, I said, right? So here actually we have cruciform suture, Bhavya, if you observe, between the true maxillary bones, like palatine process of maxillary bones, we have intermaxillary suture in violet color. This true palatine bones, interpalatine suture. So intermaxillary and interpalatine sutures are continuous. Here you have a suture between the palatine and the maxillary bones. You call it as palato-maxillary suture. Palato-maxillary suture. So overall, it
Yeah.
looks like a cross, hence you call it as cruciform suture. Okay. So this is like
An
cruciform
X.
suture, incisive fossa or
Yeah.
foramen. And I told
Across.
you this is the alveolar arch for the teeth. 2, 1, 2, 3. We
Mm-hmm.
have learned the dental formula also. Like,
Mm-hmm.
then this is the superior or inferior orbital fissure, this one. And whatever labelings have been given, you can just see. We know like this is the zygomatic arch. Okay. I said this is foramen lacerum, foramen ovale, foramen spinosum, carotid canal, jugular foramen, occipital condyles, posterior condylar canal. Okay. External
Mm-hmm.
occipital crest, highest nuchal line, external occipital
External
protuberance,
occipital protuberance.
correspondingly superior and inferior nuchal line.
Inferior nuchal lines.
Yeah, very good. So we have mastoid process, styloid process, stylomastoid foramen, mandibular fossa, isn't it?
Mm-hmm.
All these things. Now let us see. This is the anterior part where we have bony palate. This is the alveolar arch. So these are the palatine processes of maxilla. So these are which is forming the anterior three-fourths and horizontal part, that is the palatine part, which is forming the posterior one-fourth. In between, I said we have cruciform suture. This area posterior, where I have shown you an arrow, that is crescentic and it is free. Here you have a pointed margin which is called as posterior nasal spine, where in the
Mm-hmm.
living body you will see like one small tongue-like projection which is hanging from the roof. You call it as musculus
Uvula.
uvula.
Oh,
There you
yeah.
have a muscle called as musculus uvulae, which is attached to the posterior nasal spine. Okay, so this is palatine crest where I am scrolling. So palatine crest is giving attachment to the palatine muscles, like insertion of one of the palatine muscles, like tensor veli palatini. Okay, it actually stretches and encloses all palatine muscles, which is called as palatine aponeurosis.
Aponeurosis.
Yeah. So like whatever I have told you, Gomar I told, Palatine Moon, maxilla pterygoid process. Almost every word I have introduced with them.
Hmm.
Yeah. Learn slowly. See, this I said this area is greater palatine foramen, where we have the passage of greater palatine vessels. Whatever name of foramen, same structures. Behind this red arrow is greater palatine foramen. Behind one small hole, lesser palatine foramen. Same thing, lesser palatine vessels and nerves. Okay, I said this area is incisive fossa. Actually, this greater lesser palatine foramen vessels and nerves actually enter through this foramen. Inside the bone, you will have a canal. From that canal, you will see it will be exiting out through greater and lesser palatine foramen. So that is incisive fossa. We have correspondingly, if you see on the lateral side, you call it as lateral incisive foramen. Okay. In front, we have the anterior and posterior incisive foramen. Whole of this area is actually called as premaxilla. Okay.
Okay.
Now, exclusively palate is shown. Now you can see this incisive foramen. Two holes
Hmm.
are given, isn't it? Cruciform
Mm-hmm.
here you can see this is palatine process of maxilla, horizontal portion of palatine bone. Okay, nicely everything has been shown. So this is the posterior nasal spine. Okay, interpalatine suture, intermaxillary suture, palato-maxillary suture. Okay, so palatine bone has been given in a different color because it's a separate bone. This is actually part of maxilla, whatever has been shown in brown. Okay.
Okay.
Huh. So in the palatine bone also, if you see more laterally, you have pyramidal process of palatine bone. So remaining
Okay.
whatever has been shown in green color, no, that is actually sphenoid bones parts. Nothing but greater and lesser, what are those medial and lateral pterygoid plates we will study.
Okay.
Ah, okay, beta. Then this is intermediate part. So in midline, median structures, see, we know like this is the posterior border of vomer. So it is going and it is, see, this is butterfly shaped bone. We have actually sphenoid. So it is just coming down and just fanning outwards, covering the middle part of the sphenoid bone. So that means this is vomer. It has two alae. It is covering this underlying bone, which is nothing but sphenoid. So
Noise.
again, so posterior border of vomer we are able to see. Inferior surface of this is one body where I kept the arrow. That is the body of the
Hmm.
sphenoid bone. This I already named. Brown in color it was in colored skull bone. Basilar part of occipital. I told you this is pharyngeal tubercle. You have small details which usually not required. We have a canals in between these bones, like which is called as vomero-vaginal canal, and here we have palato-vaginal canal. Okay, which gives passage to this area is all related to pharynx, no, pharyngeal vessels and nerves. Okay. So
Okay.
here also Homer color has been shown in yellow. Now this picture is actually very beautiful. You can see the ala of the Homer is covering the body of the sphenoid bone. So whatever is in blue butterfly shaped bone is nothing but sphenoid. So this is body. Then we have medial pterygoid plate, lateral pterygoid plate. Then this is the greater wing of the sphenoid bone. Lesser wing we will see usually in the orbit, between which you will have the orbital fissures. Okay.
Okay.
This is foramen ovale, behind which you have foramen spinosum. Ovale and spinosum. This is foramen lacerum. So just so the palato-vaginal canal. We know like this is vomer, right? It is just divided
Okay.
into covering the body of the sphenoid. So here you have a canal which is called as palato-vaginal canal. We know this is foramen ovale, foramen spinosum, foramen lacerum. This is also foramen ovale, foramen spinosum, foramen lacerum. This is styloid process,
The styloid process.
mastoid.
Mastoid.
Excellent. Foramen magnum. Okay, beta. So this is
Mhm.
medial pterygoid plate, lateral pterygoid plate.
Lateral pterygoid plate.
So paramedium. So suppose this is midline structures on either side of midline, you call it as paramedian. So we have these two plates, medial pterygoid plate and lateral pterygoid plate. Okay. So this forms the infratemporal surface of the greater wing, this area completely. Infratemporal
Hmm.
surface of the greater wing of the sphenoid bone. Okay.
Hmm.
So what are the paramedian area showing? We are finding the smooth area of temporal bone is squamous. Okay. Where the one which is associated with the external acoustic meatus, this particular part of the temporal bone is tympanic part. Rest of the temporal bone, which is very much irregular and which is as though it's going to hurt if you touch. So that particular area is petrous part of the temporal bone. Okay. So we have squamous part, we
Okay.
have tympanic part, we have petrous
Mm-hmm.
part of the
And
temporal bone,
petrous.
the
Mm-hmm.
paramedian region. So this is the medial pterygoid plate. So here you have a fossa, that is the here. In between the medial and lateral pterygoid plates, you have scaphoid fossa. Okay, we are talking about the pterygoid plates. So medial pterygoid plates, posterior border. Now this becomes the posterior border, which is free. Okay, so you are finding there is one midline projection on the medial pterygoid plate, which is called as pterygoid hamulus. Okay, it gives attachment to tensor vili palatini. Okay, that much you remember. Processes to
Mm-hmm.
barriers and all not required. But don't trouble yourself with unnecessary details. This is exclusively sphenoid bone. So this is body of sphenoid bone. We have wings like lesser wing, greater wing. Between lesser and greater wing, we have superior orbital fissure. Okay, and this is the foramen ovale, behind which you will have foramen spinosum. Then just now we have seen two plates like medial pterygoid plate, lateral pterygoid plate. So medially you have the pterygoid hamulus also. This one, pterygoid hamulus. Between medial and lateral pterygoid plate, you have a fossa. More on the medial aspect of the medial pterygoid. Lateral aspect of the medial pterygoid plate, the depression is nothing but scaphoid fossa. Scaphoid fossa. Okay, this you can see, this is the scaphoid fossa. Now coming to the red arrow, you can see this is the lateral pterygoid plate. It has medial surface, lateral surface. This is quite important point. Anyhow, we will repeat when we study muscles of mastication. See, lateral surface of the lateral pterygoid plate gives origin to lateral
Okay.
pterygoid muscle. Medial surface of the lateral pterygoid plate gives origin to medial pterygoid muscles. Both are the muscles of mastication. Okay. So this is actually forming the medial wall of
Yeah.
infratemporal fossa. Okay. When you come to the posterior wall of lateral pterygoid plate, it is free and it is connected to the spine of the sphenoid bone. This area will be spine. Spine of the sphenoid bone through a ligament called as pterygospinous ligament. Not required. Don't remember that detail. Nobody will ask you. Then infratemporal surface of the greater, this is greater wing of the sphenoid bone, where I am showing you the arrow, not this one, this one. That is the greater part of the greater wing of the squamous part I am showing you. So it forms the roof of the infratemporal fossa. So there is a structure now here, arrow, sulcus tubae between posterior medial border and vitreous temporal largest. See, this is the cartilaginous part of the auditory tube. You can like just ignore. So you have
Hmm.
these two openings.
And right behind it is where the um carotid canal is there, right?
Yeah, yeah. Right behind it, we have the this one, carotid canal.
Hmm.
So we have two important foraminae, that is the foramen ovale and spinosum. Okay. This is 3 marks question, which you should remember. Foramen ovale. What are the structures? Male, you have to remember. So we have mandibular nerve. Okay. Then we have accessory meningeal artery, lesser petrosal nerve, and emissory vein. Okay. So these are the four
Okay.
structures. Important 3 marks question. What are the structures passing through foramen ovale? Okay.
Okay.
Now behind foramen ovale, we have foramen spinosum.
Mm.
So we have seen like middle meningeal arteries passing through this. Okay, and nervus spinosus, that is the trunk of mandibular nerve. Okay, from the trunk of
Okay.
mandibular nerve, one small nerve comes, you call it as nervus spinosus. Now, this is the spine of the sphenoid bone, which is giving origin to attachment to the following structures. This is not important, just for your information. It
Okay.
gives attachment to posterior fibers of tensor veli, palatine, tensor tympani. Three ligaments are attached to spine of sphenoid, like sphenomandibular, pterygospinous, anterior ligament of malleus. Laterally, auriculotemporal nerve passes, medially chorda tympani nerve. Now, this fossa is mandibular fossa. Okay, so mandibular fossa, it has certain fissures. Now you can see the anterior part is formed by temporal bone, smooth part, you call it as squamous part. Posterior part is formed by the external acoustic meatus area. So between them, you will find there is a fissure called as squamotympanic fissure. Squamous part of temporal bone and tympanic part of the temporal bone. In between the fissure is squamotympanic fissure. Okay. As you go more medially from this mammotympanic fissure, you will see two more fissures like petrosquamous and petrotympanic fissure. Okay. What are passing just for your information? Nobody will ask you. So through these fissures,
Okay.
the chorda tympani nerve passing, anterior ligament of malleus, tympanic branch of maxillary artery. Nobody will ask you. Just for your information.
Okay.
So this is mandibular fossa. Completely, this is mandibular fossa. This is squamous part of the temporal bone. This is the tympanic part of the temporal. Hence, you got this squamotympanic fissure. This one, petrotympanic and petrosquamous fissures. Again, we have. Now, this is irregular foramen you are finding. This is nothing but foramen lacerum. So, foramen lacerum anteriorly, you can see it is formed by the greater wing. Anterior boundary is contributed by greater wing of sphenoid bone. This point behind is apex of this temporal bone, petrous part of the temporal bone. This is medial boundary, which is nothing but basilar part of occiput. I have used the word basi-occiput. So medially it is formed by basilar part of the occipital bone. Okay. Then anterior wall, it is again this canal. This is pterygoid canal. So posterior wall, as you were telling, this canal will be the carotid canal. Okay. So carotid canal actually passes the internal carotid artery. Simple. It's surrounded by a plexus of sympathetic nerves and also accompanied by vein. So here you are finding this is actually interior view, internal, from inside, cranial fossa view, not outside view. So you can see carotid canal.
Okay.
Carotid canal actually leads into foramen lacerum. There will be a continuation. Inside there will be a passage. You can see this is carotid canal. You can see how it is leading into foramen lacerum. That's the reason I have used this picture. That is from the inside. Middle cranial fossa, this is actually, not from outside. Not norma basalis, but middle cranial fossa area. You can see the continuity or continuation of the carotid canal with the foramen lacerum. So that's how you are finding this foramen lacerum upper part. It is conveying internal carotid artery into this middle cranial fossa. Lower part, when you see from outside, it looks closed only. Okay. Then carotid canal, like we have, it is giving passage to internal carotid artery. So its passage will be oblique. When you just pass the probe, you will see it's not in straight line. So it is actually like it is little curved upward because it will be leading into, see from here you will have internal passage till here. Internal carotid artery is passing through this hole and then it is traversing this and entering into foramen lacerum. So you can imagine it's not straight. It is like turning forwards and medially. Okay. It is forward. See,
Yes.
it is turning forwards and medially, and it is moving towards the posterior wall of foramen lacerum. This is carotid canal. This is foramen lacerum. Carotid foramen lacerum. The direction is like this, forwards and medially. Okay. So we have in the posterior part of the norma basalis, we have foramen magnum of the occipital bone. Okay, so these are the two condyles which are called as occipital condyles, which articulate with the atlas bone, first cervical vertebra, to form atlantoaxial joint. Here, atlas comes in articulates to form atlantoaxial joint. Okay, oh no, atlanto-occipital joint. Atlanto-occipital joint. So these are the two occipital
Okay.
condyles. Okay. So condylar part of each side, these are the two occipital condyles. Okay. So we know like this is mastoid process, we know this is styloid process. Then we are finding like portion of the like inferior surface of this irregular posterior part of the petrous part of the temporal bone. So foramen magnum can be a 3 marks question. So it
Hmm.
is oval, it is wider behind. So overall, you can see antero-posteriorly, it is measuring 3.5 centimeters. We just measure transversely, it is measuring 3 centimeters. On either side, you are finding two condyles, which are nothing but occipital condyles, which gives attachment to the alar ligament. That means connection between the atlas, first cervical vertebra, and occipital condyles. We have alar ligament. Thence, you will see the projection from the second cervical vertebra, that is axis. When we do vertebral
Okay.
anatomy, okay, you can for now see this is the alar ligament, this is dense. Okay, from here you will see the communication into the foramen magnum. Okay, so this is foramen magnum, this is alar ligament. You are finding it is projecting from dense. Okay, now what are the structures which are passing through foramen magnum? That will be the question. So main thing is you will find medulla oblongata continuing as spinal cord. You will find the blood vessels like anterior spinal artery 1 number 2, posterior spinal arteries 2, vertebral arteries, spinal root of accessory nerve. The other structures we see attached to the foramen magnum are, just now we have seen alar ligament. The dense is also called as odontoid process. The projection from second cervical vertebra, which I said as dense, also it is named as odontoid process. So behind that, this whitish area is all bony part only. So in this bony part, you also see the other attachments like upper band of cruciate ligament. We have membrana tectoria. Okay. And within this foramen magnum, you will see projecting, not coming out, they are visible, like a part of cerebellum, which is the tonsil part of the cerebellum. So if you can practice this diagram, you can write all the contents. By looking at this diagram only, you will get 3 on 3, even if you don't have time to write the text part. Okay.
Okay.
That is. So whatever is texted here, no, is all listed here. The same thing is texted here. This is one more picture
Okay.
which has been taken from Chaurasia. So same thing what we have discussed there is written here.
Okay.
So anterior and posterior margins. See this anterior and this is the anterior margin. This is the posterior margin, which is giving attachment to atlanto-occipital membranes. Okay, middle part is this one. Uh, it's known as basium. This area exactly. I have shown you already external occipital crest. We have seen superior, inferior nuchal lines. Muscle attachments we will do when we do the back. Back muscles, they all take origin from there. Trapezius, sternocleidomastoid attachments are there. Splenius muscles are there. We will see later. When we do that corresponding area, then it becomes easy for you. Then condylar part of the occipital bone, these are the occipital condyles. Okay. So we have two pairs of occipital condyles, and this area is jugular foramen. Correspondingly, the process which arrow has been marked, you call it as jugular process. So occipital condyles are oval. So they are present anteriorly to the foramen magnum. So they are articulating with the lateral mass of atlas to form atlanto-occipital joint. So in front of them, can you see here, there is a hole, you call it as hypoglossal canal, also called as anterior condylar canal, which gives passage to hypoglossal nerve. That is more important. If you can remember, you can also write meningeal branch of ascending pharyngeal artery, occasionally emissory veins. Behind, what did I say? Posterior condylar canal. If this is anterior condylar canal, this will be obviously posterior condylar canal. So you are finding like this is actually first cervical vertebra, that is atlas. Here the occipital condyles will come and they get articulated to form atlanto-occipital joint. Below this atlas, you are finding second cervical vertebra, that is axis, and this projection of axis is nothing but dens, also called as
Yes.
odontoid process. Dense odontoid process. Okay. So this is condyle, right? Just behind this, whatever fossa is there, you call it as condylar fossa. This is posterior condylar foramen, where we have the passage of emissory veins. Okay. So this I said as jugular process. Jugular foramen. This is also jugular foramen, jugular process. Nobody will ask you jugular process, don't worry. Jugular foramen is very important. Okay. It's very much
Okay.
the two structures which are passing through jugular foramen. We are
Internal jugular vein, right?
yeah. And 9th, 10th, 11th.
11th cranial nerves.
Yeah,
That would be glossopharyngeal, vagus, and accessory.
yeah, very good. So actually in the jugular foramen, you see in front we have the jugular fossa and the vitreous part of the temporal bone. Behind we have the jugular notch, which is seen in the occipital bone. So it is divided into anterior, intermediate, and the posterior part. So anterior part is giving passage to inferior petrosal sinus. Intermediate part, as you said, 9th, 10th, and 11th cranial nerve. Along with that, here we have ascending pharyngeal artery, meningeal branch, emissory veins everywhere. Posterior part, internal jugular vein as a continuation of sigmoid sinus. Okay.
Okay.
So commencement of internal jugular vein, you will see there will be a dilatation that is called a superior bulb, which is you can see if you have skull bone that is lodging in the jugular fossa vitreous part of temporal bone. Just checking if anything is important. No. Stylomastoid
Okay.
foramen is important. It gives passage to facial nerve and also stylomastoid artery. This is mastoid process. This is styloid process. Okay. Then
Okay.
uh, but a few more important things I want to tell. See, styloid process gives attachment to 5 important structures, 3 muscles and 2 ligaments. We have stylohyoid and stylomandibular ligament. We have 3 muscles like styloglossus, stylopharyngeus, and stylohyoid muscle. Stylohyoid, styloglossus, and stylopharyngeus muscles. Stylohyoid ligament, stylomandibular ligament. Okay, so that is important. Styloid process can be a 3 marks question. Similarly, mastoid process also can be a 3 marks question. So posterior aspect of the mastoid process gives attachment to the sternocleidomastoid, posterior belly of the gastric, and the stylohyoid like muscle also. Okay, then there will be a groove which is actually lodging the occipital artery. Okay. So this mastoid process you have to study, styloid process you have to study. And before I end, I also would like
Mm-hmm.
to tell you the structures passing through other foraminae which we didn't discuss, like superior orbital fissure. So superior orbital fissure will be giving passage to, remember, third, fourth, fifth, sixth cranial nerves. Third, fourth, fifth, and sixth. Third is oculomotor, fourth is trochlear, fifth is trigeminal. Ophthalmic branch of trigeminal will pass through the superior orbital fissure. Sixth is abducent. So third, fourth, sixth would be supplying extraocular muscles, whereas fifth, that is the ophthalmic division of the trigeminal, will be giving sensory supply to the upper part of the face. Okay, just trying to check with one more color diagram. This will take. So foramen ovale, male structures you remember. Foramen spinosum, you see, like it gives passage to middle meningeal artery. Foramen lacerum, you remember internal carotid artery. Carotid canal also, you remember internal carotid artery. Jugular foramen, three compartments and structures we have studied very well. Hypoglossal canal and posterior condylar canal also we have studied very well. Foramen magnum also we have discussed. Stylomastoid foramen also we have stylomastoid artery and also the facial nerve emerging out through this foramen. This is external acoustic meter. So whatever foramina you are finding at the norma basalis, you should know what are the structures emerging. Okay, hope that is clear, Novya.
Yes, ma'am.
Just revise once and then you will understand everything.